listeners. Welcome to Good Morning Kenya. My name is JMM. We are glad you are with us this morning. Remember, our communication platforms ever remain open, and we'd love to know where you're watching us from this morning. The official hashtag on Twitter is Good Morning Kenya. Our official station handle ever remains at KBC Television. Our individual handles at Raymond Yara, at Ramaguko, at Doreen Arange, and at JMM is how you can find us across all social media platforms. Our Facebook page is also accessible. KBC Channel 1 TV is the handle, and our SMS number on the top left of your screen, 20154, is how you can send us those short messages. And remember to leave a name. We'd love to read your messages and address you by your name as we go through your messages, and also where you are watching us from this morning. So right now we want to continue with the day's discussion, and we are moving on to our health segment for the day, as we always do every Tuesday on Health Tuesday. And today we're going to be talking about an issue that is quite rampant, very touchy, unspoken about, but it is happening. It is claiming so many lives, especially for our young girls, but we still choose to turn a blind eye. But why is that the situation? There's so much that comes into play when you talk about this particular topic, and I would love for you to be part of this discussion, and we just want to hear from you. Questions, comments, clarifications that you may be needing. We are here to help you better understand that. And this is just to get clarity on the state of legal abortion and post-abortion care here in Kenya, given it has seen quite a journey here in Kenya, legally speaking. And I have a panel of three fantastic guests this morning to help us better understand where we were, how things have been, and where we are today, and what the situation is, and what more we need to do as a population to just try and bring down the number of cases that we are seeing, the number of deaths rather, that we are seeing as a result of abortion here in Kenya, especially among our younger girls. To my extreme left, we have Nixon Kimeta, who is the director at Exhale Africa, and he also runs an online program dubbed She Matters. Karibu sana. Glad to have you this morning.
Thank you very much.
At the center, the only other lady with me here in studio, she is Mercy Akinyi, who is the program coordinator at Trust for Indigenous Culture and Health. Karibu sana.
Thank you, Jen.
Good to have you this morning.
Thank you for having me.
Karibu sana. And to my immediate left, we have Martin Onyango, who is a senior legal advisor working with the Center for Reproductive Rights. Karibu sana.
Asante, Jen.
Glad to have all of you this morning, hoping to have such a fantastic discussion in regards to this issue that is abortion. And we are going to be speaking within the confines of the law. Let it be known, we are not advocating for abortion. We just want to understand how far, legally speaking, does, the extent of the law when it comes to abortion. And I'd quickly like to just start by understanding what your organization does in line with this discussion for the benefit of our viewer, of course. And I'd like to start with you, Nixon. Exhale Africa and She Matters, just briefly, what do they do in line with this conversation that we're about to have?
Thank you, Jane. Exhale Africa, it's an organization that deals with information dissemination through media. And in this particular case, we have an online portal called She Matters Now. She Matters Now, basically, it's a platform that disseminates information on sexual reproductive rights. Yeah. And we have been receiving so much feedback from the public through that particular portal.
Yes, yeah. Sexual reproductive health and rights it's also another whole area that we are still yet to embrace and come to terms with as a population. Yes. But let me come to you, Mercy. As the program coordinator at Trust for Indigenous Culture and Health, maybe tell us a bit about what your organization does.
So my organization focuses on providing information on sexual and reproductive health and rights. We also do advocacy to ensure that progressive SRHR laws and policies are put in place and are being implemented. Yeah.
All right, and implemented to the latter.
Yes.
Yeah. Yes, because implementation is usually the problem.
Yeah.
All right, let me come to you, Martin, as a senior legal advisor, a lawyer, working with Center for Reproductive Rights. From a legal point of view and from your organization's point of view, maybe help us understand what your organization does.
Thanks, Jane. Center for Reproductive Rights is a global legal and advocacy organization. We use the law to advance or to promote reproductive rights as fundamental human rights.
Yeah.
As you know, in Kenya, health is a right in our constitution, including reproductive health services. So what we do is to ensure that we push for a legal and policy framework that will enable all of us, both men and women, to have meaningful reproductive lives and to access those services as of right. So we are largely on law and policy. Yes.
And I believe
we also we go to court when there is
when
no
When
implementation.
needs to be.
Yes, when it's necessary, we go to defend the rights of women and girls to access reproductive health care.
When implementation becomes compromised,
Yes,
because that is not always a problem.
Yes.
All right, now for the benefit of our viewer, we cannot presume that everybody understands what we mean when we talk about abortion, and especially medically speaking. And I'd like to start maybe with you, Marcy. Layman's language to just help our viewers better understand when we talk about abortion, medically speaking, what does it really mean?
When we talk about abortion, we mean termination of a pregnancy. And in this case, we would like to talk about safe abortion and unsafe abortion. Safe abortion is whereby a woman accesses this service by a professional, a qualified health professional in a conducive environment with the right commodities. And safe abortion is the complete opposite of safe abortion. The service provider is not trained. The environment in which he or she provides the service is not conducive, and he or she does not have the right commodities for provision of the service.
All right.
Maybe
yes.
just to jump in, you see, when we talk about abortion generally, our listeners may be confused because
and you get scared at first.
Yes, and here we are talking about legal and policy environment in the country. It is worth noting that in Kenya we've gone as far as not only providing for abortion in the constitution, but we've actually enacted a law. The Health Act has clearly spelled out what is what abortion, what you've asked.
What constitutes.
Yes, that it is the termination of a pregnancy before viability. So I'm sure this is where the contentions normally begin, that there is a stage in a gestation where you are now not allowed by law to have a termination. Yes. So
now, when you just look at such a situation where, as a population, there's this sense of lack of clarity on what abortion is. Before we came on air, we were having this conversation about the billboards that were put up, terming abortion as something else. Do you think this lack of clarity has also been part of the problem that we have been seeing when it comes to this conversation about, abortion and legally speaking here in the country? Let me start with you, Nixon.
Jane, what I know is that there's a lot of misinformation out there. And because of the misinformation, people are basically confused. And like even what you've mentioned about the billboards that were put up some time back last year, they were stigmatizing, and at the same time they were misinforming the public. And that lack of information is what is really confusing our citizenry. So for me, where I come from, where we disseminate information, we disseminate the correct information for the public to be aware, what to do, what not to do, and what the law stands for. Because the service providers and also the people who are seeking the services are not aware of where the buck stops. So it's quite important the information be put out there in the correct format and in the correct way.
And the correct information.
And the correct information for that matter, yes.
All right. And today we're having this conversation to just try and understand the legal extent to which abortion is allowed by the Constitution. And I'd like to come to you, Martin. Just looking at our country's journey, it has been, when it comes to especially abortion, it has been an up and down, rocky, left, right, center kind of path. But we'd like just give us a quick rundown of how things have been. And I understand there was a case study that was used to just sort of contextualize the whole situation.
Thanks, Jen. Before we get to the case study, I think it is good to know that why is it so important as a country to talk about, for the issue of abortion as a public health issue. Among the top 4 leading causes of deaths among pregnant women is the first one is bleeding, hemorrhage. The second one is infection. The third or the fourth is unsafe abortion, and then obstructed labor. So among the top 4 leading causes of death among expectant women is unsafe abortion. And you know, as a country, one of the undertakings or the promises the government has held from when we committed to the 2015 Millennium Development Goals and now to the 2030 SDGs is to have zero maternal death, to have no woman dying because of a complication related to pregnancy and childbirth.
Yeah, that's
so
true.
If one of the leading causes of death of women in pregnancy is unsafe abortion, the question is, what should we do about it? And the answers to this existed pre-2010 Constitution and post-2010 Constitution. Pre-2010 Constitution, doctors, the health service providers said we need to treat or prevent unsafe abortion, and where a woman seeks abortion, they need to have post-abortion care as of right. And then in 2010, because of the challenges that existed there, after very lengthy discussion, Kenyans actually now agreed to provisions in the Constitution that now specifically speaks to when abortion should be allowed within the law. And that is when the life of the mother is in danger, when the health of the mother is in danger, in emergency situations, and if allowed by any other written law. And these should all be subject to the opinion of a trained health professional. And the trained health professional here, we are talking about a doctor, we are talking about a nurse, we are talking about a clinical officer, we are talking about a midwife. What the Constitution has done is then to leave the question of whether a pregnancy should be terminated or not to be made by someone who has been trained in treating people, not somebody who holds a religious or a moral persuasion. So
and that is where most people go wrong.
So it is a treatment between the woman and the trained health professional, and also not a quack, not somebody in some back street somewhere who is not trained, who is not certified, whose clinic is not licensed. So that is what we said in 2010, and that is what then the law that is now prevailing. But it is good to ask ourselves that in real life, how do instances of unsafe abortion occur? And the case study we are talking about here is the most affected group is the youth and adolescent, the age group of 16 to 24. It's most affected. Why is it most affected? One, it is the age group that has the least level of information on sexual and reproductive health and rights. Two, there are challenges in accessing reproductive health care services because of including issues of stigma to services like abortion. Difficulty in accessing contraceptives. We still do not have 100% penetration of contraception to all the age groups, especially that particular age group. So if we look at, but also we also see that from the public health sector, I'm not talking about private institutions, our public health system has not addressed reproductive health needs publicly, providing the public information on contraception, public information on addressing unsafe abortion. In these circumstances, in 2013, a young girl was actually defiled. A young girl who is 14 years old was defiled by an adult, and because of this lack of information, she didn't report this, and 2 months down the line, she misses her periods twice, and she realizes she's pregnant. she discloses to the closest friend with whom they were sharing a room. So what does the friend tell her is that, I do not know much, but I know someone who can help you. Who is this someone she's referred to? Is a backstreet or an untrained person purportedly providing abortion services. So they look for money from friends, and they actually go to this quack who performs on her an unsafe abortion. But because of the lack of skills, the poor environment, she develops what we call infection. And because we have stigmatized reproductive health care, she could not share with anyone for a couple number of days what had happened to her until she now got very sick and had to be rushed to a nearby dispensary as a matter of emergency.
Okay, and we're going to continue with that to just try and understand. As so far we have seen stigma is a problem, lack of information is a problem. And, so far we've just been talking about the girl child, being the one who is heavily involved in the conversation, but also looking at our male counterparts. From that you have just mentioned, it is a young girl who was defiled by a grown adult for this matter. Are we doing enough to involve our male counterparts when it comes to this conversation about abortion? I'd like to hear from you, Mercy.
Even as I answer that question, I'd just like to mention that JMM story, the girl that Martin is talking about, is a very sad story. She went through a very excruciating experience that no girl or woman should go through.
And it's only one among the many.
Yeah, one among the many. Actually, a study was done by a partner organization called APHRC, and it shows that in a year, there are 465,000 unsafe abortions that are procured by women, and 7 women die daily. That means, Jane, half a Nissan, the 14-seater Nissan, die daily due to a preventable cause. So he has mentioned that the main cause of this vice is lack of information on sexual and reproductive health and rights, and the fact that sexual and reproductive health and rights issues are majorly stigmatized. You find that at home, our parents cannot talk to us about sex and sexuality.
Yes, sexuality.
At school, comprehensive sexuality education is not being implemented. In church, we cannot even dare talk about these issues. So we find that we end up with the high number of teenage pregnancies, the high prevalence of HIV among young people. We end up with the low uptake of contraceptives, the high number of rape cases in Kenya today. We end up with the high number of unsafe abortions that ultimately lead to the high maternal mortality and morbidity rates in Kenya today. So as an organization, we saw that there is this knowledge gap. And so we have a hotline that provides information on sexual and reproductive health and rights to even male counterparts. So we seek to empower people in that way so that they can make informed decisions. We give information on contraceptives, we give information on STI prevention and treatment, we give information on post-abortion care, we give information on, we offer telecounseling to victims of rape, and we tell them what to do, who to contact, who to report to. And other than that, our program enables us to have community meetings. So we create safe spaces where we bring in girls, women, men, and boys to share their experiences on sexual and reproductive health and rights. So we empower each other in that way. We are able then to make informed choices. So we find that when a girl faces a problem, if her partner knows and if they're in a relationship, then they're both informed. So it comes from a consensual perspective, and it's also very important because they're both empowered. There is power in information.
Yeah.
The other thing is that we do advocacy on sexual and reproductive health, like I mentioned earlier. So we partner with organizations like CRR, we partner with organizations like Excel, and we leverage on each other's expertise and strengths. So that way we ensure that there are SRHR policies that cater for all, for both girls, women, men, and boys.
Okay. Now, also when it comes to involving medical practitioners, because they are ultimately the ones who will be expected to, they are at the center of this conversation. Are we doing enough to also even just empower them? Because stigmatization can come from any point of view, and it's worse when it comes from this medical profession that we have out here who are not as empowered as it ought to be when it comes to dealing with such cases. And I'd like to hear from you, Nixon, maybe from even what you have heard, you know, from the population, from the projects that your organization has done, when it comes to how our medical practitioners handle cases to do with abortion. Are we doing enough to also empower them and inform them so that they are better positioned to address some of these cases?
From where I sit, I don't think I'm better placed to answer that because we do information dissemination, through the various media. And maybe that somebody else can take on that because we don't do trainings per se, one-on-one. But I'd like to add from the kind of information that you've been sending out there to the public. I think the monster in the room is one, which is unsafe abortion. Yeah, I don't know what my colleagues think, but any other day when you go out there to talk to the public, we talk about a blanket abortion, you know, but I think we forget to talk about unsafe, because from what I gather is that abortion is wide, and there are instances which is allowed, by the law, and it's protected, and there are several instances that lead a doctor to make that decision, and the doctor will make that decision, and when the life of the mother is in danger. But the question is, there are other, like now the kind of feedback we get and the kind of information that the public is yearning for. They like to understand it better, and they want to know at what point can they be able to seek some services. Sometimes it's psychological problems that they have. Sometimes it's relationships that at the end of the day, those issues can end up with a counselor. But the problem is that and I think that's why the numbers are so high in terms of, you said about how many? 465,000 every year. Those are women, women and girls we lose through, not abortion, unsafe abortion. So how do we save these women? Because at the end of the day, if they don't have the information, they will go to the back street. So number 2 monster, quack. It's whose duty to make sure that there are no quacks. Because for instance, I'm trying to imagine if there were no quacks, what would happen? Like in the instance of JMM Case, she did not have information. And she went to a quack. Underlined quack. Number 2 underlined unsafe. That's why it ended up, and it's a sad story, though. And that is what we need to understand. So let us not talk about abortion as if it's just a blanket, and it is unsafe. If we could deal with the issues of quacks, then the rest will be history. Because from where I sit, Martin can advise us more. There are instances where the law provides for that. So I tend to think that's where you need to start from. And the kind of information we send out there, the feedback that I get, through She Matters Now, even boys, you will find that someone has been having a relationship, and the boy is like, no, this one we can't have, or something like that. They want to get the information. They want to learn, And in the process, because there is no information out there, quack.
Ending up to misinformation.
Misinformation.
Yes, but just quickly.
I'd like to take on the question on medical practitioners. We also realize that there is lack of information amongst medical practitioners. Now, the law says that in the opinion of a qualified health professional, now this health professional, first of all, lacks training on how to provide the service, and lacks information on what the law says. Then they will not provide the service to a woman who is actually within the brackets of the law, okay? So it's very important to train them. We do that as well under the Right Here, Right Now project that we are part of. We train medical practitioners on what the law says, and including, the legal framework of access to safe abortion in Kenya right now. So it's very important for them to be aware so that they provide the service also within the law.
Okay. Yes.
Yes. Before I get to the question of health professionals, how they are engaged, I think one of the things we may lose in this discussion is the question of sexual violence. That one of the high drivers of unsafe abortion is also sexual violence. Children who have been defiled, incest, those who have been raped, and when there is no clear information on where to seek help and how to seek help. So that is one of the drivers that we also need to address. But back to the question of the involvement of health service providers. The responsibility of government in providing health services is one, to create a favorable policy environment to guide the health service providers, to have training structures so that they are competent to provide all healthcare needs that patients will come with to them in the respective facilities. So what the government of Kenya has done, and for a very long time, while there are so many causes of maternal deaths, the government did not have standards and guidelines to train health professionals on how to manage unsafe abortion, how to prevent and manage the question of unsafe abortion, up to until the year 2012, when the Ministry of Health developed those guidelines. But unfortunately, 1 year down the line, because of what I would call the push and pull, those who are not interested in a subject for moral or other persuasions opposing the issue, those guidelines were withdrawn. However, because of the challenge of that withdrawal, last year, the High Court reinstated those guidelines. So that as we speak now, the government, the Ministry of Health has in place guidelines, one, on information provision on prevention of unwanted pregnancies, have guidelines on how to manage the termination of pregnancy. They have guidelines on how to manage post-abortion care, how to provide contraceptives. There are guidelines on how to monitor and report back to government how the system is doing. The question we must ask ourselves is, the Ministry of Health, is government doing enough to have this information out there, to have this as part of the training, to have this available, so that the question of unsafe abortion should not be a discussion that is left to health facilities only or to private health facilities. It must be a public health discourse. If this is the third highest cause of death of women in this country, we must discuss it on the table, just like HIV. The reason why we are making good progress in dealing with the HIV scourge in this country is it has affected all of us. In one way or another, somebody who is infected or affected, it affected all of us, and we came to a realization that we must discuss it so that we deal with it and approach it as a public health issue. We are trying to do that with abortion, but we realize there is still a bit of resistance here and there. But I strongly believe, with the commitment of the Ministry of Health to leave no one behind and to achieve zero maternal death, that is where we need to get to.
But ultimately, it doesn't just boil back down to the Ministry of Health. There's so many stakeholders who are involved in this. It's an ecosystem as a whole, and there's so many stakeholders who have a role to play. There's the government, there's our teachers, parents, religious leaders. Looking at all these other stakeholders, do you feel they're also doing enough to, especially, let's now focus on each individually. Let's start with the religious institutions. Everybody has a religious affiliation, in one form or the other. Are we doing enough to just talk about some of this conversation about abortion from a religious point of view, given the hold that they have here in the country, to just sort of keep the conversation going? And I'd like to start with you, Mercy.
Wow, we are not doing enough in terms of from the religious aspect. We are not doing enough. Like I mentioned, sexual and reproductive health issues, including access to safe abortion, these issues are highly stigmatized.
Yeah.
Okay? And the reason as to why they're highly stigmatized is because of how we've been socialized, our cultural beliefs, our religious beliefs, you know, and the education that we get in school, in our schools. So you'll find that at school, our parents, the teachers do not want to implement comprehensive sexuality education. Why? Because of their religious beliefs. Our parents are not talking to us about sex and sexuality. Why? Because of our religious beliefs. At church, we are not being taught about this. Why? Because of the religious beliefs. And even as we implement our activities in communities, we face a lot of backlash because of the religious beliefs. So we are not doing enough, because this issue is not a moral issue.
Yeah.
And we are approaching it from that angle, okay? But at the same time, there's someone in church, there's someone at home, like Martin said, you are either affected or, you know, you are going through it, okay? It's actually your sister, your mother even, or your friend, okay, going through it. And so we are not doing enough in that sense.
Especially from that point of view.
Yeah.
Now, let me come to you. When it comes to parents and teachers, and this always back and forth between the teacher says it is the work of the parent to talk about their sexuality to their children, and the parent says, I am paying you to teach my children about sexuality in school, and ultimately, this I don't want this to happen because I'm paying you to teach these children. When it comes to having these conversations about sexuality with our children from a younger age, is it something you would advise parents to start doing? Because ultimately, haba na haba hujaza kibaba.
Yes, yeah. I tend to think that is the duty of the parents. So it has to start from home, so that you can be able to talk to your children about issues with sexuality. Because if you don't do that, they will seek information from other quarters. And woe unto you when they get information from the wrong party.
The wrong sources.
Yeah, and the wrong sources. So they will end up in a mess. Yeah? And then to add on what you say, there's something that I call stigma at the pulpit. Yeah? If you condemn such an act so much at the pulpit, and you find that maybe someone had already procured an abortion in an unsafe way, you continue stigmatizing this person. Yeah? So again, I will say that so much work needs to be done so that people can be informed, you know, with the correct information, so that you don't end up stigmatizing more. You don't end up maybe encouraging quacks.
Yeah.
Because where do quacks come from? Number one, I tend to think it's because there's a need and there's a business.
There's a gap they've seen.
There's a gap they've seen, you know. People don't want to talk about these issues, you know. And that is why, because you cannot start a business that has no demand. Yeah. So it means the demand is there. And if it's there, any Tom, Dick and Harry will wake up one day in the morning and say, you know what, I need some money. Let me start my own small funny clinic over here. I'll be giving people some funny medicine, you know. If you die, I don't care. So at the end of the day, it means the problem is there. Let us speak candidly. Yeah? And for the institutions which are doing awareness, so much needs to be done so that even the clergy needs to be informed. Pole pole. They'll understand. Yeah? Because what they're trying to save are the deaths of these women.
Unsafe
unsafe abortion.
Because in this case, it's more of one-sided information.
One-sided information. You know, we're not tackling the problem. Yeah, we are tackling something else so different. Yeah, we are tackling abortion as a whole, but it's happening. So the question is, why is it happening? You know, if we talk to our children, if we give them the correct information, dealt with women and made them understand, you know, at the end of the day, there'll be no business for quacks. So there'll be no gap. Yeah.
All right.
And hence the zero
maternal mortality.
Yes, that one.
Okay. Yes. Now coming back to the JMM case, you know, we got to the point where she had procured the unsafe abortion and went back home. Take it up from there.
the JMM story,
to just understand how
she
it
went
unfolds.
back home, was taken to the nearest dispensary because of lack of sufficient skills to handle those emergencies. She was given poor quality treatment right from the dispensary up to the county referral hospital. They could not manage her condition, but you see, with infection, that is one of the leading causes of death, the high infection was getting worse until she was referred to Kenyatta National Hospital almost 1 month down the chain, when she now got comprehensive care. However, because the infection had become so grave, she developed kidney diseases related to the infection, and she died in the year 2018 around June. So for me, the story of JMM is just a depiction of how grave the problem is.
The chain.
The chain.
The chain,
And it's
yeah.
living with us. And you see alongside the chain, because of lack of information, because of lack of training, because of stigma, because of lack of facilities, the system failed her from her first point of entry into our healthcare system to get remedy. Why? Because we've stigmatized reproductive health services. The net effect is that she died. But you see, she's just one whose case has been reported. Thousands die. By the year 2013, it was reported that around 2,600 were dying every year. 7 every day because of these preventable causes. And so it simply means that we need to address the problem holistically. And I will tie that to the question, what we are saying, what are we doing, especially from the religious sector. While we've said a lot still needs to be done, it's good to point out a few positives. Last Sunday, I watched a feature in a media station where religious leaders were now taking up the quest for contraceptives for their faithful. I think that is a positive step that needs to be commended, because it starts with preventing unwanted pregnancies. It starts with informing the congregation on what options, and that when you have a problem with the pregnancy, you need to go to a trained health professional, not a quack.
Yes.
So even from the pulpit, there can be positive and life-impacting information. And we need to actually congratulate the clergy who are doing the right thing to save the lives of women and girls, and ask everyone to be in the forefront in preventing preventable maternal deaths.
Yes, and that actually
And
brings...
by the way,
just go ahead.
As a Christian also, again, judge not.
But we always do.
Yeah, judge not. So who are we to judge somebody else?
Yeah.
The work of judgment has to wait until we get to heaven.
Yeah.
Yeah. So
Now, bringing in the conversation about contraceptives, it's also another area that we choose to not pay as much attention to, and especially for our younger girls. When it comes to this conversation about contraceptives, there's always two directions that it goes. There are those who have access to it and misuse it. They don't need it. But those who don't have access to it and they need it. What do you feel needs to be done to sort of bridge this gap so that those who have access to it understand why they have access to these contraceptives and not misuse them, and those who do not have access to these contraceptives can actually get access to these contraceptives when they need them?
Jen, it still boils down to giving the right information. When you have the right information about contraceptives, you won't misuse contraceptives. When you have the right information about contraceptives and how it will help you, then you will you will go to a youth-friendly facility or the hospital to access contraceptives so as to avoid unwanted pregnancies. The problem that we have right now is that those who cannot access, they cannot access either because of poverty. When they go to the hospital, they are asked for money. They do not have that money. They still end up having or getting unwanted pregnancies, and that results to unsafe abortion. So it still boils down to information. When you have the right information, you cannot misuse contraceptives, and when you have the right information, you will see the need to access contraceptives.
And also, does it always have to be just a girl discussion? Let me hear from you, Martin.
No, the question of, for me, the question of reproductive healthcare services must be a question of both girls and boys, men and women, male and female. It cannot be a question for one gender. And two, reproductive health services needs to be looked at as a continuum, and it's a whole spectrum. It is not just about information. It is information about what, and then what are the products. So that it begins from information for everybody, then it goes to all services. Prevention of unwanted pregnancy, management. You know, when we talk about reproductive healthcare, we forget that actually access to quality maternal health care. When you are expectant and you are going for your antenatal care, you need to be treated with dignity. When you go to deliver, the delivery process should treat you with dignity. You should feel honored and dignified as a human being. You need to get quality care, so that it is not just about contraception, it is not just about abortion, it is about the whole spectrum of services, including the proper management and treatment of newborns until they grow into children, so that we cannot segment it. And the problem we have is that we try to compartmentalize that. Okay, we can talk about maternal health care, about going for antenatal care services, dignified birth, but we forget to talk, or we avoid talking about the fact that at one point in the life of a woman, she may need to access safe abortion services from a trained health professional. That in the course of her reproductive life, a woman will need contraceptives. So we cannot compartmentalize reproductive healthcare services. We must look at them as a whole, and we cannot stigmatize a particular one. It simply means that in the whole cycle, it must involve both male and female. It must involve both government and non-state actors.
And I also think that, I mean, in that chain of, by the time you end up seeking for abortion services, it starts from somewhere. And it starts from unplanned or unwanted pregnancy. And so the question should be asking yourselves, why? I'll give you a case of like one of the cases that I handled was schoolgirls not even accessing sanitary towels. In the process, so you find that sanitary towels is also again a problem, because if young girls cannot access, they'll look for means and ways on how to get those.
Sexual transactions.
Yes, okay. About a guy will just tell them, you know what, you've soiled yourself, that's stigma. What is he going to do? Provide the sanitary towels. The next thing, we'll ask for favors. The next thing, you're pregnant, unwanted, you know. So we need to get back, and understand where are these problems. If we can provide sanitary towels, you know. So at the end of the day, you find that it ended up to an unwanted pregnancy, and maybe it ends up in unsafe abortion.
Yet it started from something
a sanitary towel.
Different. A sanitary towel.
A simple thing like sanitary towel. That's what I'm saying. From, you know, and that's feedback that I'm getting from my portal. She Matters Now, and some others, small things like the need for a P2, a post-natal, you know, they don't know where to access it, you know, but they'll tell you this has happened, you know, contraceptives, condoms, you know. So we need to be candid and realize that the problem of unsafe abortion starts from somewhere. And then we start dealing with those issues. So that's what I'm saying. Let us not bury our heads in the sand and ensure that we deal with where it starts from. And that's the feedback that I'm getting from my portal, and that's what I can be able to give out.
And ultimately, you will find this cause or the source is something distant, so separated from the actual situation, yet it's something that is completely preventable.
But you see, menstrual hygiene, menstrual health is part of reproductive health. So information, menstrual health, contraceptives, access to safe abortion, quality maternal health care, quality dignified birth. You see, it's all interlinked.
Because Jen, remember, for this lady or woman to become pregnant, she was not alone. Something led to that, and once it reached there, you know, what were the underlying issues, So let us not stigmatize these other the end result of seeking for abortion services, and we forget the whole spectrum, because I tend to think the misinformation that's out there is that when you discuss about sexual reproductive health and rights, yeah, someone basically thinks that straight it's abortion, you know, as opposed to looking also the other and looking at the other underlying issues.
Okay.
Yeah.
Now, when it comes to just chatting that path towards bringing people together onto the same page, it has to start somewhere. It is a journey. We cannot just say it's going to happen in a day or a year or a month. It is a journey we have to walk as a nation. And we all have a role to play when it comes to this. And let me start with you, Masi. You are very passionate about information. Information is power. What are the other channels, or what channels do you feel can be best utilized to help put this information out there about abortion and safe abortion legally, what is within the confines of the law?
There are so many channels that can be used to pass this information at home, yeah, with our parents, with our sisters, in school through comprehensive sexuality education, okay, at work, even with your colleagues. If you have information, it's just a matter of disseminating that information. So there are so many channels, our radio channels, and it's also a way to destigmatize abortion, because you can be at home with a sister who has gone through it. It's not something that is very easy for someone to go through. Yeah. It has its own challenges. So if I'm at home and I can't talk to my own sister, I can't talk to my own mother, it starts from that point. Like, can I talk to you about it? So it starts with destigmatizing abortion, and then talking about giving out information, the accurate information that you have. Though we are not so sure about what we consume online, because the information that is online is not, there's some information that is valid and accurate and that can be beneficial to you, and there's information that can be actually a threat to your health, especially with sensitive issues like abortion. So it's good to get like a counselor, talk to someone who is knowledgeable about the issue, like a health professional, or our CHVs and CHWs know about these issues. So talk to them, get the information, and
you will be better positioned. Yeah. Now, let me come to you, Martin. Still looking at ways in which we can charter that pathway to solutions. There is abortion and there's unsafe abortion, and there is now, legally speaking, access to safe abortion, but there are also other aspects that come into play, and things to do with cost, and especially looking at the population who cannot afford some of these costs that are related to procuring these safe abortion services at medical facilities, or an environment that contains, or rather has the qualified practitioners that are needed to procure such a procedure. What do you feel needs to be done to sort of help this population that may need these services but cannot have access to it because of the financial responsibility that is involved in some of these procedures?
Thank you. I think that brings us back to the discussion of universal health coverage. Abortion is health care. Reproductive health services is part and parcel of the basic health care. Actually, if we address reproductive health care needs, we are almost 60% into dealing with all our health issues in this country. So health is a right. Health is a primary obligation of government. So that the same way we allocate money for malaria, that is the same way we need to allocate resources to address unsafe abortion. It simply means that access to safe abortion services cannot be left to private health facilities where I must chuck money. Access to safe abortion services must be in the public health sector, so that the private health sector just complements. The public health sector is then financed by the public, and in line with universal health coverage, it simply means that the most vulnerable in our population will have been covered under the public health system. So they are guaranteed access to safe services in public health facilities or in private health facilities, but guaranteed and financed by the public. Abortion is healthcare. Reproductive health services is part of healthcare. If we are then to guarantee everyone access to health services under universal health coverage, we cannot afford to leave any health service, including abortion, outside the discussion of what then becomes the core components of our universal health coverage. That is my view. And you see, in that framework, it simply means that we would have strengthened the policy and regulatory framework, the training. So all pieces and bits are in place to ensure that the whole health system works.
Yeah.
We cannot afford, and for me, this speaks to public institutions, and that is why I put the Ministry of Health and other government agencies on the spotlight.
At the center
the
of it.
primary responsibility to provide health care lies with government, so that those who seek for these services outside that protection are people who are now of means and can pay for it from private providers.
Okay.
Otherwise, it's obligation of government. That is why we pay taxes, and that is why we demand of it for it as of right. When not done, we can't challenge government for not doing it.
Okay.
Yes.
And also when it comes to accessing the fine, it will be, it's one of the aspects of universal healthcare, should be incorporated. But now we also have the practitioners who have to be involved in the process, ensuring that they are qualified, they know what they're doing, and they're actually offering the correct post-care that is needed. Let me hear from you. Maybe what do you think can be done to sort of encourage this among our peers and also the government, the practitioners themselves?
It all boils down to information, and then the information being disseminated to all the stakeholders, including the medical practitioners. Because I bet even now there's some who are not even aware that there are guidelines in place. Someone seeking those services, there are proper guidelines. Or Martin, can I properly say that?
Yes.
There are guidelines for proper, safe, legal
Post-abortion care.
Safe abortion care and post-abortion care. And the guidelines are there. So I tend to think it's all about maybe the various stakeholders, the ministry. Goes back to train its own the medics. At the same time, information be disseminated out there that actually there are some guidelines for safe abortion care and post-abortion care.
And it's worth also adding that what in my experience I've found is that while in training many of our health service providers are trained comprehensively, when they come to practice, that is where the challenge exists, because they are not certain about the regulatory environment. And who gives direction the regulatory environment is the Ministry of Health. It is that uncertainty that then puts many practitioners in a 50-50 situation. But the ministry needs to clarify to them, but also needs to inform them. The regulator needs to tell them, this is the law, these are the guidelines, and yes, abortion is allowed in our country under the Constitution, under these circumstances. And these are the people who are allowed to provide abortion services, and so these are the regulations that you need to follow. That ought to first and foremost come from the ministry. Of course, we encourage providers to proactively go out there, look at the laws, look at the Constitution, look at the guidelines. But we want the ministry to take up the mantle and sensitize them. You see, the policy guidelines in the health sector comes from the Ministry of Health. They need to be at the forefront of telling providers, this is what you need to do. That is all they need. And where there is need for training, they need to be at the forefront of providing avenues and opportunities for training and new skills, because how we used to treat malaria 10 years ago is not how we treat it now. The same applies to all health services, including abortion care. There are new technologies, new inventions. That is what you need to update all providers on.
All right. And also still on, I'll be coming to you in a minute, still on post-abortion care, it's not just about getting the services that you need there and going. There's also the mental and psychological state well-being that is also has to be taken care of, especially for the younger girls who have been involved in these cases. And maybe, Marcy, coming to you, what are some of the channels that maybe your organization is putting up, or programs that can help these young girls navigate through these waters? Communication platforms, programs, seminars, things like those that help these girls deal with it psychologically?
Yeah, so like we've all mentioned, the issue of abortion and even post-abortion care is really stigmatized.
Yeah.
So it's very hard for a young girl or a woman who has gone through that to come out in the limelight and share their experiences on the same. So what we've done is with our hotline, it's very confidential. At times when you're going through these things, you just need someone to talk to. You just need to talk, and through talking you heal. So that's what we offer at our hotline. We offer telecounseling. So we'll provide the information, we'll refer you, but other than that, we'll follow up with you. You know, it's a journey that we will walk with you. Other than that, at times telecounseling is not enough. So we work with professional counselors and we link the women and girls to these counselors, one-on-one counselors, and it's absolutely free. You don't have to pay for anything. The other thing that we do, of course, is, you know, having the meetings with them, okay? Having meetings with them. In as much as we create safe spaces, not everyone will come out and talk about it at that point. Even after the meetings, we will still meet with them and they will still have that, you know, they'll feel safe, not judged about the issues that they have gone through. Okay. So those are the channels that we use as an organization to tackle the mental health of girls and women who have gone through abortion and even post-abortion care.
All right, and before we wind up, you'll be giving us the toll line number, the hotline number that girls who have been affected can be able to reach out through and get the counseling that they may need. Yes, you had something to add.
Yeah, what I wanted to add is that I also wanted to add on what Martin was saying, that it's also the duty of the medical board to ensure that these quacks do not exist in our streets. Yeah. Whose duty is it? The government should be able to pluck them out from where they are, from these funny clinics, from the mitishamba guys, you know, who basically administer that concoction, in the name of this will happen. Because remember, at that point, when a woman or a lady goes to seek such type of services, she is confused, she's not in a proper mental state, and anything goes, and for her, in her mind, she has made that decision. So it's proper, and with the guidelines, I'm very sure they also provide for counseling services, before any service is procured. You have to go for some counseling, you know, in such particular instances, and since that information is, since now we know that the guidelines are there, you know, it is very easy for someone to go and seek services from the correct place, And the police also, they're supposed to be the ones who are arresting these quacks in the streets. As I said earlier, if we deal with the issues why people go to those quacks, the quacks will not have business, so they'll be plucked out. They'll be out of business, so we won't have maternal death due to such unorthodox manner.
Okay, and given that you've mentioned now the police, they also have a vital role to play when it comes to being part of the stakeholders when it comes to championing for abortion and safe abortion and, you know, post-abortion care. How can they also be involved in the process, given the guidelines that were reinstated, that they're stating their role when it comes to this whole conversation?
Thank you, and it's good you raised the issue of the police. One of the challenges we've had with the police is that actually the police have been a great threat to access to reproductive health care. Why? The police conduct raids on licensed clinics that offer abortion services within the law. The police have made it appear that abortion is completely unlawful in this country.
And the highest crime.
And it's the highest crime. And what they do is they use this then to extort licensed clinics and then they promote business for the quacks. What the police must, yes, I would say the police have actually been pushing business to the quacks when you target licensed health facilities that offer abortion services within the law. This is how the police can come in. One, the police need to know the position of the law in the Republic of Kenya, from the Constitution to the Health Act, and then the judgment that then reinstated the guidelines that clearly specified that the police cannot arrest and prosecute a trained service provider who has provided abortion services within the law, or a woman who has sought abortion services within the law. So the police should be at the forefront of, one, enforcing the Constitution and the law. 2, they need then to, following those guidelines, please, they need to handle the quacks. Arrest those who are not trained, arrest those who are not licensed, and prosecute them because they are putting many women and girls in danger. And the police need to be in the forefront of actually empowering the public that abortion services within the law are allowed in this country. So if you have a reproductive health need, if you have a challenge with pregnancy and you need to speak to a trained health professional, go to a licensed facility. If we find you in some back street, unknown place, we will arrest you and we'll arrest the other person. You know, that gives confidence in the health sector, but also enables us to hold accountable those who are trained and licensed. Because if somebody who's been licensed, a facility that has been licensed to offer services, does something wrong, it is easy to pinpoint them because we know who regulates them, we know who supervises them. But we can't do that to the backstreet people. So for me, that is the role of the police. They must stop the intimidation and the extortion of licensed facilities that provide abortion services.
All right. Now, as we bring the conversation to close, you know, we've been talking about the provision that is there in regards to, at least legally speaking, the provision that were reinstated in regards to abortion and, you know, post-abortion care here in Kenya. And for the benefit of our viewers, I'd just like to come back to you, Martin, and I'd quickly like for you to just sort of state them very briefly. What are some of those provisions that are within the law when it comes to abortion and post-abortion care?
One, I will start with post-abortion care. Post-abortion care is emergency care. Access to emergency health services is guaranteed, and there is no debate about that. So access to abortion services within the law, abortion services are allowed, one, when in emergency situation. Who determines when a situation, an emergency situation, is a trained health professional. Emergency situation, when the life of a woman is in danger, or when the health of a woman is in danger, or if allowed by any other written law. And give me a bit of time to explain this. Emergency situations, when life is in danger, those are fairly clear-cut, and those are decisions that will be made by a trained health professional. When the health of a woman is in danger, the court has expounded the health to include physical health, the mental health, and the social well-being of a person. And if in the opinion of a trained health professional, this affects their well-being. It simply means that access to abortion services is left between the woman and the trained health professional. And who is a trained health professional? I repeat again, it is only a doctor, it is only a nurse, it is a clinical officer and a midwife who are trained, registered and licensed to offer health services. Any person, a pharmacist, somebody, a lab technologist, those are not trained health professionals. So we need to limit ourselves to that. And besides those, then when allowed by any other written law, the other written law that has been recognized by the courts to allow access to abortion services is the Sexual Offences Act, that allows survivors of rape and defilement to access abortion if they so choose. So that if a woman who's been raped, a child who's been defiled, and they have conceived, the care post-rape failed to stop the pregnancy and they've got pregnant, the law allows them to go to a trained health professional to explain the problem. They will be counseled, and if the best decision is to terminate that pregnancy, they are protected under the law. It simply means that under these circumstances, the trained health professional or the woman cannot be arrested, cannot be charged. They are broken no law. They are protected by our constitution.
It is within the provisions
of the constitution and the law of the Republic of Kenya. And for me, that is really the information that we need to get out there, both to women and girls who are seeking reproductive health care services, to service providers, but also to law enforcement agencies.
Now, as we bring the conversation to close, I'd like to quickly get to your closing remarks in regards to this whole conversation about abortion and post-abortion care here in Kenya, and what more we need to do, everybody, to just make sure that the right information is out there, given the new provisions that were put in place last year.
my parting shot will be, let's get informed about sexual and reproductive health and rights, about access to safe abortion, about post-abortion care. And if you're going through a sexual and reproductive health issue, you don't have to go through it alone.
Yeah.
You don't have to be stigmatized or even stigmatize yourself about what you're going through. So that's why we are there. That's why we have a hotline. You can call our hotline. It's absolutely toll-free. You will not be charged, because we found out that that is one of the challenges that women and girls face. They do not even have airtime to call the hotline. So the hotline is toll-free, and you can call us anytime. The number, can I say the number?
Yes.
The number is 0800 721 530. I'll repeat, 0800 721 530. You can call us at any time. We will work with you and we will give you information that you need.
All right. Closing remarks.
What I'll say is that let us not bury our heads in the sand. Yeah. There's a monster out there. We need to deal with it. And as the portal says, she matters now, not tomorrow. Yeah.
Now.
These are our sisters, our brothers, our mothers. You know. And at the end of the day, yeah. Everybody, I'm very sure, if we opened up our hearts, yeah, everybody has been affected directly or indirectly, yeah. Maybe someone died through unsafe abortion, you know, but you kept quiet as a family, yeah. And I cannot imagine that every day I receive inquiries from not less than 4 people every day, yeah. It's either question A, question B, then we do a lot of referrals, yeah, through our social media portal, shemattersnow.com, yeah, and that's I came to realization that this issue is real, yeah, and if you hear the numbers of deaths that occur through unsafe abortion, my goodness, it's crazy. It's crazy, yeah. So let us accept that we have a problem. Let us deal with it, yeah. And let us be open. Let us discuss the issue. Let us not discuss the issue of unsafe abortion without first of all finding out where is the root cause. Yeah, and let us deal with those issues. If it's sex education, how can we tackle it? Yeah, do we need also to come up with a kind of an awareness program for our parents so that we can know how we can be able to disseminate information to our children? Yeah, because I'm trying to imagine in the olden days, in the path of growth, yeah, you'll be taken through some kind of trainings, maybe by the aunties or something like that, which is lacking now. Yeah, do we accept that we have a problem? Yeah, and then also again, if I go back to the clergy, yeah, can they be open-minded? Yeah, first of all, instead of saying no, yeah. First listen, yeah, understand, you know, and the golden rule, judge not. Start from there, and then understand why are these people dying. Because if we continue saying no, the numbers might rise up, yeah, they will not go lower, yeah, because that's a fact that the numbers are crazy. Yeah. So I'm saying that let us be open-minded, let us look for solutions, yeah, and let us provide the correct information to the public.
Your closing remarks in regards to this conversation as well.
In closing, I would say that abortion is healthcare. We need to deal with the need of reproductive healthcare comprehensively. For stigmatized services like abortion, I think there is need to go out and really speak up and provide protection to the vulnerable. And why we do this is that it is apparent that while many people talk about HIV now, you see the HIV scourge is progressively being managed, nobody is talking about the emerging challenges to the healthcare system, like unsafe abortion. Yeah. So we need to have a comprehensive approach to reducing maternal mortality from unsafe abortion. Nobody should die from preventable causes. And if that is the commitment of everybody, then we need to, every cause that is causing a death of a woman during in pregnancy, must be addressed. Irrespective, it is not a moral, it is not a religious issue, it is a medical issue, it is a health issue. Let us deal with it as a health issue, let us deal with the causes, and let us deal with what is limiting our ability to address unsafe abortion as a public health challenge. The laws are there, let us enforce them, and let us provide comprehensive protection to the entire population.
It is a health problem. It is not a personal issue. It is not a moral issue. It is a health problem, and it's part of maternal health care. It is a problem that needs to be addressed. We need to stop turning a blind eye to this. Remember, we've been talking about the state of abortion, and legally speaking here in Kenya, looking what the law provides for when it comes to abortion and post-abortion care here in Kenya. And in relation to this discussion, last year on the 12th of June, a 5-judge bench reinstated the standards and guidelines and gave the provisions through which abortion can be procured here in Kenya. So if you are a medical professional, a qualified medical professional, you need to get up to date with these guidelines, get to understand what they provide for, what they allow, what they do not allow, and how you can best go about in offering this service and post-abortion care to those who may need these services. We have been speaking with 3 fantastic panelists who have helped us better understand and get clarity on the state of abortion, legally speaking, here in Kenya. To my extreme left, we have Nixon Kimeta, who is the director at Exhale Africa and also runs an online platform dubbed She Matters Now. Thank you so much for making time this morning.
Yes, thank you.
At the center, we have Mercy Akinyi, who is a program coordinator working with a Trust for Indigenous Culture and Health. Thank you so much.
Thank you, Jen.
We appreciated your time this morning. And to my immediate left, we have Martin Onyango, who is a senior legal advisor working with the Center for Reproductive Rights. Thank you so much.
Thanks, Jane. Looking forward to another insightful discussion like this.
At the forefront in just championing from some of these conversations that needed to be talked about.
Thank you.
Well, that is that for Health Tuesday. Remember, we absolutely appreciate you for being part of this discussion and sharing with us your thoughts and comments. My phone just died. I am not able to sample some of your questions and comments, but we will be addressing them as and when we are able to. But for now, we just want to call it a discussion. Thank you so much for being part of this. We always appreciate that you choose to start your morning with us right here on Good Morning Kenya. Do remember to join us again tomorrow. We have fantastic interviews coming up tomorrow. With Lifestyle Wednesday, we'll be looking at matters concerning with Nairobi County as well as education issues. So you don't want to miss out on that. So do remember to catch us tomorrow from 6 a.m. all through to 10 a.m. for nothing but the best of breakfast shows. My name is JMM, and on behalf of the entire Good Morning Kenya crew, do have a lovely day. Enjoy the rest of your viewing. See you tomorrow.